Good afternoon, all the ladies and gentlemen present here today. Yes, continual learning is the key for continual living. Once we stop learning, we start dying. That has been said by the people. So, as we are here from Association of Nurse Executive of India to empower each and every nurses with the knowledge, information, we are conducting the Empower Hour for the last January 2024 by every chapter. And this particular hour, while we are going to empower our nursing faculties, but we are focusing on how we can focus on engaging patients and their families for preventing harm so that our nurses can do the better. With that intention, we have started by each chapter, and this chapter we are going to have by Telangana chapter. We have our very strong, capable chapter head, Haritha, who will be leading today's discussion. And I know we have the various people like from the diverse field and very strong, powerful patient too, to get involved, to give us suggestion, to give us clues to reform our healthcare services. So just to talk about, many of you might be knowing about our vision about ANEI. So our vision is to provide leadership, professional development, and research to advance nursing education, patient care, while effectively towards India's health goals. And our mission to work with all stakeholders in establishing a system for improving the nursing scenario across, thereby impacting the patient safety and clinical all settings of healthcare. And with that, we already started our ANEI in 2017, and we are having the around 1,000 members now approximately, and we are having different chapters in the different states of the country. And I must mention the founder officials of ANEI. I can say even it is a brainchild of them, Association Nurse Executive of India, particularly Madam Ms. Thangam Gomez, founder president. She was, I can't say she was the founder president, but she is now too founder, strong pillar for us, continuously guiding from the front and behind and developing all the nursing professional through research, education, and all the ways she can. Madam Thangam Gomez and Madam Juti Clara, founder, national vice president. She is too with us now, actively involved and has done marvelous in the beginning. And Madam Subhara Sakurikar, founder, national secretary, who has contributed a lot for this ANEI. She is also supporting us. And Madam Captain Ajita Nair, founder, national treasurer, who is very strong. See, under her leadership, we as a president now, we are going forward with many other diverse activities. And I, as a vice president, Dr. Unmana Borgohai, and Dr. Vinci Tiruvan, she is a national secretary, very strong and powerful, and of course, Lieutenant Colonel Dr. Aji KL, national treasurer. That these are the four official. We are, but we are nothing without the chapter heads, without the pioneer members, without the executive members, and without the founder officials. So this way, this month, this year is going to get over, and next month, I'm hoping that Kerala chapter will do. Then we'll be having Karnataka and Maharashtra chapter. Just would like to put up one slide for you about the patient safety. Yes, while talking for this one, the empowering for the nurses, why we are talking about the patient safety. Yes, patient safety is becoming a cause of concern as the healthcare delivery is becoming very specialized and complex. Healthcare, and we see every individuals are unique, every individual needs are unique, and approaches are different. Healthcare delivery requires coordination between team members. Without team members, we can't do anything. And with that intention, and we from the month of January, under the help of Madam Gomez, that we are doing that, the members in this panel discussion Empower Hour, we are having the quality member, doctors, nursing officers, nursing educators, and particularly the patient or the patient families. We are getting to hear directly from them. And we are so fortunate. So many things we are learning from the patient particularly. The expectation are helping us to make the better strategy for tomorrow. And medical harms happen when this coordination lack due to the communication failure. Many safety checks that healthcare system have in place may not work as they should and cause avoidable harm to the patient. It is now well recognized that patient too can play a significant role in minimizing this avoidable harm. Yes, we have to design our tailor our healthcare delivery system according to the need of the patient. If we are not taking note of the patients before we plan the care, how we can progress? So Patient for Patient Safety Initiative is a movement to sensitize and empower patients and caregiver from WHO initiative. So this is only the conceptualized view I'm sending to you all. And with this, I'm hoping forward that this discussion will be very much fruitful and very much expert panelists are here, and it will definitely, they will enlighten us. And with this, I'm concluding my initial remark, and I welcome each and every member to this discussion. Also, if anyone is not yet member who are joining here, not yet member of ANEI, please join it first. It is not only this discussion, there are many fellowship program, research program, education program, and continuous learning is going on. And I hope you will enjoy. Thank you very much. With this, I'm ending my welcome remark, and I would like to call upon Madam Harita to take over the session. Thank you so much.
Thank you so much. Very warm greetings for all of you from Telangana chapter. So it's great honor and privilege for me to be here today, especially as the host of this Ember Hour for this month. You have definitely made my role much easy by briefing ANEI and the activities, vision, mission for everyone who is here, who may be new to it and who is a part of this association getting connected first time. So we do a lot of activities at national level as well as the state level. It basically to empower nurses by giving them right knowledge and engaging them in research activities and also enhancing them in nursing leadership. I have a very distinguished and esteemed panel here. I'm sure that this learning is going to be yet another great opportunity for all the participants, those who joined across India. So I could see the participant list of 50, but I also make a point here that many School of Nursing, College of Nursing, and the institution join here from one ID, which is denoting as one, but the group will be more in number. So with this intro, let me take this opportunity to thank everyone for being here, especially our panelists for today. And thank you all for being here. And let us have a great learning of another 1 hour. I have my state secretary here, Bindu. Bindu, quickly message to the team, and then we'll hand over the session.
Good morning, everyone. I have just traveled this morning and come so, a little bit late to join, but better late than never. So, hearty welcome all the participants and the members who are participating in this discussion, especially the individual who has agreed to come and discuss with us the patient side of the story or patient's perspective. Hearty welcome to all of you. And this shows that how open ANEI is for ensuring patient safety. To what level, to what extent can we as a team march forward to ensure patient safety? And patient advocacy, as it rests on nursing hugely, definitely it is an apt topic for us to discuss at the moment. And I would like to urge anyone who is listening to today's discussion to be a part of ANEI. It is a proud, an organization that we would be proud of being a member. And the kind of educational activities, the informations, the current informations that is shared among the members is quite huge. So this is also an encouragement from our side for anybody who has not yet become a member to be one at the earliest.
Yeah.
Thank you. So with this, I will conclude my words and let Harita take the session further.
Thank you so much, Bintu. So now what I do, I hand over the session to one of our ANEI member, who is Ms. Jyoti Mary, and she will take us through this Empower session. Once again, thank you so much and best learning. Speaking.
Thank you, ma'am. Thank you so much for the introduction and for setting the stage to begin with our today's session, or the Empower Hour, on engaging patient amidst multiple abdominal surgeries, engaging patient in decision-making to ensure safety, hosted by our Telangana chapter. There is a need for engaging patients in all activities we do, especially in preventing or minimizing preventable harm, which happens during the treatment in our hospital. And we all of us know the end users are our patients. I'm sure that all of us would agree that ensuring safety is our prime responsibility. And I am very happy to see the galaxy of people who have joined for this Empower Hour to be part of the panel for today's discussion, who will throw light on the topic in 360 degrees. I'm sure that this talk will be instrumental for ensuring prevention of harm among our patients. Here I am to invite our distinguished panel members. As I'm acknowledged and happy to say that, we have our patient, Miss Janet, who is from Zambia. We are lucky to have her for this today's session. Miss Janet is a nurse by profession. So I welcome you, Janet, for this Empower Hour. We are very happy to have Dr. Partha Sarathi, Senior Consultant from Department of Gastroenterology. Sir is a very, very busy person. Thank you so much, sir, for taking out your time for us. Sir is a laparoscopic hepatopancreatologist. Thank you, sir, for being part of this flagship monthly session of ANEI. We have another important person, Ms. Kavita Singh, Operations Head, Care Hospitals, Malakpet. Thank you so much, ma'am, for accepting our invite and for being part of this session. I also would like to invite Dr. Radhika, Chief Dietitian, HOD Dietetics Department from KIMS Hospitals, for having consenting for this program. I also welcome Ms. Sunita, ANEI member. She works as a nursing quality officer from Yashoda Hospital, Secunderabad, for being part of this session. A warm welcome to Dr. Venkateshiva Santosh Reddy, Manager, Clinical Pharmacy from AIG Hospitals, to this Empower Hour. I also welcome Mr. Ranji Naik, RN, Ostomy Care Specialist from Coloplast. Without further ado, let's start the discussion. Meaningful engagement of patients, families, and community can improve healthcare quality. Yes, I request our panel members to turn on their videos as we are going to start our panel discussion. Thank you. Definitely my first question will be to our patient, Janet. Ms. Janet, could you please turn on your video?
Thank you so much. Good afternoon.
Good afternoon, Janet. My question to you is to give us a brief idea about you, and also a question to you, that is, being a foreigner to the country and to the healthcare system and having undergone multiple abdominal surgeries, can you share your journey with us?
Thank you so much. Good afternoon, everybody. Am I audible?
Yes, you are audible.
Thank you so much. My name is, before I introduce myself, I would love to say thank you so much. It is an honor, and I'm so humbled to be part of this audience this afternoon. As the moderator has introduced me earlier, my name is Mumba Janet Nakazwe, and I'm coming from the southern part of Africa in a nation called Zambia. So, as the theme says for this month, engaging patients amidst multiple surgeries, I'm just going to give you a brief history. Most of you might be wondering to how these multiple surgeries were born. So I'm just going to give you a brief history on how these multiple surgeries came about. So I am, I have a total number of surgeries, 13, amounting to 13, of which among these 10 are laparotomies and 3 are cesarean sections. I've also undergone 2 ileostomies and 1 colostomy. So I'll just give you a brief history. I'm a mother of 3 children, and all these children were born through cesarean sections. And during the delivery of the third child, some retains of conception were left in me. And due to delayed care or intervention by my fellow medical personnel in my home country, the retains of conceptions led to peritonitis. And when peritonitis set in, it led to loss of certain organs, like some of my intestines, the uterus, the appendix, the ovary, and hysterectomy was done. During the, sorry so much, hysterectomy was done. So among these 13 operations, 7 were done in my home country, Zambia, of which they declared me dead in my home country because they couldn't do anything. Because of the intensiveness of the infection that had spread, they couldn't combat the infection. So they started operating me almost every week. I would go to theater maybe twice in a day. In the morning when they operate on me, the wound kept gaping. In the evenings, they would take me back again. So in total number, I had 7 laparotomies in my country because they couldn't do anything. I said, let me try India. Please bear in mind, I already had the 3rd cesarean section. So I was airlifted from my home country to India, where I found my hope. I call India my other heart, my other home. A shout out to my Indian family. Thank you so much. When I was airlifted to India, my abdomen was literally open. I held my organs like in my hands, and fecal matter was coming out of the abdominal gaping day and night. When I reached India, I reached with a colostomy. I had 2 ileostomies in my home country, of which, since they could not work, they were reversed within a period of 2 weeks. And then they had to perform a colostomy, which did not work. I traveled to India with this colostomy, which started operating in India. From 80 kgs, my nutritional status was altered, and I started weighing about 30 kgs. I call myself a miracle. When I reached India, they had to operate me 3 times, of which the third one was the reversal of the colostomy that I had traveled with. So amidst all these operations, I experienced a situation where I was psychologically broken down. I was let down by my own medical personnel, of which wouldn't have led to all these multiple operations if there was proper care and quick intervention. When I was in India, I had to undergo these 3 operations, of which I spent about 4 months, almost 4 months in India. So during this operation, I took 3 points: psychological breakdown, my self-esteem was lowered down. I experienced different type of people from my home country and India. And I noticed to say there was a huge difference. From a patient point of view, I would say I met people that gave me support, gave me a positive mind, and I met people that literally left me out. I felt neglected. But I must mention to say, when I reached a foreign country, that is not my country, I found hope again. I thank God, being a Christian, my God, it's something that I didn't put aside. And through all this journey, a positive mind, being optimistic through it all, having hope that I was going to walk through all these surgeries is what kept me going. But I must mention it wasn't an easy experience, because not only me was broken down, my family, my children, and everybody that was around me. It was a situation whereby procedures that I was doing on my patient that I wouldn't think would happen to me in life, it was happening on me at that time. The fact that I had to undergo fistulas, odors that were coming from my wounds, really broke me down. I must give a special shout out to India, because throughout my journey, whilst I was there, I was given a positive attitude. My doctor, thank you, Dr. Fatasarati. I'm able to speak good from a patient point of view, because he kept me. He's one of the reasons, perhaps he doesn't know, perhaps you don't know, sir. You are one of the reasons why I kept pushing whilst I was that side. Your support, your care, and your communication, and the way you involved me in my care just triggered that fighting spirit within me. In summary of my brief introduction, I would say I experienced pain, lowered self-esteem, and I met different types of medical personnel, which being a nurse, today I'll be able to save and avoid certain things that I saw on my hospital bed. That's all I can say for now. Thank you so much.
Thank you, Janet. Yes, indeed, you are a miracle, no doubt. The crowd,
Thank you.
participants who are witnessing this, everybody, it is a miracle. Yes, thank you so much for sharing your journey. Of course, it was very painful. Yes, you had hope, and that's why we could see you here. Thank you so much. My next question goes to Dr. Parthasarathi, sir. So what is your say on engaging patients for preventing harm and ensuring patient safety? Because most of the time we cannot engage fully, and we are not much indulged in this culture of engaging patients for their treatment. So how did you find this aspect while you treat your patients?
Good morning, everyone. At the outset, I would like to congratulate ANEI for taking up this, keeping the flame of learning alive and putting in so much of zeal and energy into organizing events like this to keep the learning going. I congratulate all of you who are involved in this program. Coming to today's discussion, this is a very relevant topic you have chosen. I think it's extremely relevant and important, which is not given due importance when it comes to managing patients. Yeah, when it comes to managing patients, a lot of focus is usually given on the medical aspect of treatment, and we forget to understand that one of the most important stakeholder in that is the patient itself. So the more you involve a patient in her or his care, your job is going to be much easier. Not only from the point of patient safety, but also from the point of their involvement is going to make them understand the type of treatment you're providing, and they will also be a part of the treatment process. So many a time you don't require so much of patient involvement, but when you come across patients like Ms. Janet, um, which is a very complex case, and as she has narrated in great detail the arduous journey she has undergone from Zambia to India and then back to Zambia as a different person now. Involving the patient gives us a lot of leverage in getting them out of their problems. So I would quickly enunciate certain points where we thought Janet should be also involved with us and we should be on the same side while tackling things. One of the important things was any patient with a stoma. Janet was not just a simple stoma. We had a stoma, and also we had an enterocutaneous fistula where there was uncontrolled leakage of contents from the intestine into the skin. So this is a very painful condition because the intestinal contents creates a lot of burns on the skin. The skin is always red. It causes excruciating pain, and no wonder the pain goes on from physical and then it starts affecting them psychologically also. Janet is one of the bravest human beings I have seen in my life. So a lot of credit to her to have fought her way through all of this. So when it comes to stoma management, initially we have to involve the patient in letting them understand what exactly is happening. They have to be made to understand that there is uncontrolled leakage of intestinal contents outside, which is going to cause rapid loss of fluid and electrolytes compared to a patient having a stomal diarrhea or a regular diarrhea. So these patients have to be made aware that they can start losing enormous amount of fluid and electrolytes over a very short period of time. It is not possible for the nurse or the doctor to actually be by the side of the patient and quantify this, because this doesn't come into a bag. It just comes into the dressing. So the patient should have an alert mind to constantly check how much of fluid is getting leaked. And if that happens, they have to replenish it himself, or they have to alert the nurse or the doctor. So initially, Janet was trained in these things, and she, being a nurse, she was quick to grasp these things, and she helped. The second was involving the patient in their pain management. So in a complicated case like Janet, where multiple surgeries were done on the intestine itself, there is a limit to which you can use opioid painkillers. So you cannot overuse opioids in these patients, because opioids themselves will cause a lot of intestinal slowing down, or ileus as you would call it, and that can cause constipation and slowing down of intestinal movement. At the same time, because of multiple surgeries, the pain score also will be very high in these patients. So we had to provide a multi-pronged approach to pain management, one being psychologically sort of making her also understand that there is a limit to which we can give opioids. And then we also convinced her to take nerve blocks, which were more uncomfortable than a regular painkiller, but they would help in terms of minimizing the need of opioids. So there was a time after the second surgery here, she was in excruciating pain. And then we convinced her to take a erectospinal block. Initially, she was reluctant to it. And then finally, when she understood the reason why we are insisting on it, she agreed to that. And we were able to give a block with continuous infusion of analgesia through that. That minimized the amount of opioid she needed, made her intestines recover faster, and she also had a good amount of pain relief. So working as a team with the patient, instead of telling the patient, I'm going to give this, you better accept this. When you are on the same side, you take the patient into confidence, you'll be able to see that the patient acceptance for procedures is much better. And in the end, both of you achieve your targets. The next is early mobilization. This is one area where, not only in the case of Janet, in most major operations, most multiple surgeries, you have to get the patient mobilized. And this is impossible to do from one side alone. The patient has to be motivated. You have to educate the patient about the benefits of early mobilization. It is very difficult for a patient who's undergone many surgeries. They'll be in extreme pain. They'll be psychologically down. Their nutrition will be low, and they will not have enough muscle power to get out of bed and walk. But early mobilization is going to give a huge advantage in terms of early return of intestinal functions. The patient's appetite will improve. Psychologically, the patient starts feeling better. So here is one time where, instead of spending 5 hours with the physiotherapist to try and mobilize, you spend 15 minutes with the patient, sitting them down and talking to them about the benefits of this over and over again. It doesn't happen in one visit or one day. They have to slowly be convinced about putting in more effort, despite having pain initially during the early mobilization. But once you do this sort of counseling every day, the patient understands this, internalizes this, they start putting in effort in terms of early mobilization, respiratory therapy, and spirometry. So this, of course, Janet, being the strong woman that she is, she was able to do it very early. But there are many other patients where we find a lot of difficulty, but we realize that the more time we spend counseling, the less time you would spend on the recovery and the early discharges. Then comes nutrition. Nutrition, generally, there is an attitude in a medical professional to write a normal diet, high protein diet, high fiber diet, diabetic diet, and go away. But we don't factor in the things that goes between an order of writing a particular diet and actually what goes into the patient. There are multiple factors which would affect this. Like in the case of Janet, she had come from a different continent, not just a country. So I have been to Zambia, so I know how Zambian food is, and we know what Indian food is. So it is, and she has come as a patient. She has not come as a tourist. So as a tourist, you're open to trying out new cuisine, but as a patient, you will want to eat your food, your home food, your soul food. Over that, there is a lot of barriers in terms of drug-induced effects on the appetite of the patient, metallic taste because of medicines, food fads, and the type of food which you get in our kitchen. So these barriers have to be taken into account, and the patient has to be educated. You also have to be sensitive to the dietary fads and cultures and needs of this patient, and then tailor make a diet wherein you are able to give a palatable diet to the patient, at the same time achieving your nutritional targets in terms of proteins and micronutrients, without which no amount of antibiotics and surgery is going to get the patient out of a complex situation. So even here too, there was a lot of cooperation from Janet, and we also were sensitive to this idea. We used to let them make and bring some foods from the hotel room. Her patient attendant used to do that, and through that we were able to achieve her dietary goals. And we also used to have a taste of Zambian food here. So these are some of the vital points which this is not an exhaustive list, but this is just to explain with an example of our case with Ms. Janet. So what are the points which one can involve the patient effectively to make a recovery faster and smoother?
Thank you so much, sir, and kudos to you, because one should have courage to operate on a patient for multiple times. So kudos to you and to your team. And thank you so much for sharing your thoughts and insights on how we can engage patient in their own care and in clinical decision makings. So thank you so much, sir. So now my next question goes to, as we've been listening that diet is an important component of patient treatment. So I have this question to Dr. Radhika. How do you think we can engage patient in planning their diet, considering the clinical condition and the limitations which we have, like their likes and dislikes? So could you please give us, throw some light on these points? Could you please turn your mobile, ma'am?
I think she just got
disconnected. No problem. We'll come back to Dr. Radhika after a while. We'll move on to the most important member of the healthcare system. We always say that nurse is the center of any healthcare system, right? So my question goes to the nurse, Ms. Sunita, who is an ANEI member. So nurse being 24 hours with the patient, she is in an ideal position to come out with many strategies where we can engage patient and their families, especially in preventing harm. So could you please tell us a few vital areas and some best practices and innovative thoughts, how we can engage them in their own care and clinical decisions?
Thank you, ma'am. First of all, I would like to thank Annie for giving me this opportunity to share my thoughts related to the patients who undergoes multiple surgeries. So as sir mentioned, Pathasarthi sir, the pain management is one of the most important thing, as the doctors can advise and they will leave. They may be counsel for a certain period, but we are the one at the patient side to console the patient when they are in pain. So the psychological support which we supposed to give to the patient, it should be more effective to understand the importance of the different medications which we can be provided to them, and they should understand. So the best practices, what we supposed to tell is that every patient should involve what kind of strategies to treat the pain. So we supposed to explain very clearly to them, and they're supposed to understand how important to treat the pain. So, and we have to take the patient's considerations whenever they are taking, and we are involving them to choose alternative methods or which is best for them. And we always used to consider their point of view and how far they are comfortable. When it's need to be administered, either maybe now blocks, otherwise any opioids, it depends upon non-pharmacological interventions also. So we have to clearly educate on that part. as well as the surgical site infection. This is the second most important. I mean, this is a mostly as Janet is experienced peritonitis and multiple infections, and that leads to another multiple surgeries. So best practices, I would like to suggest one thing that as our hospital is practicing that, so we have surgical site care checklist that we would like to give before the surgery, the patients who are scheduled for certain surgeries, especially major surgeries. So in the checklist or handout, so it's clearly mentioning that what type of complications may comes because of the surgeries, especially at the surgical site, and how to identify those symptoms, like how inflammation comes, what kind of signs they can exhibit, like at the surgical site, like a redness or any inflammation, any oozing, what that kind of, that we encourage the patient to understand early the detection of the signs and symptoms, so that we can identify early and to treat immediately to prevent further complications of because of that infections. So that the best practices I would suggest either handouts or any other kind of materials if we provide before the surgery itself, that is very effective. Then the patient can read and they can question us before surgery what kind of questions, what kind of practices we have to practice after their surgeries. That is like a hygiene practices, otherwise the dressing changing of frequency, and hand hygiene practices and the sterile techniques which they can be follow after the surgeries. So these are the best practices which they can be follow if they known by seeing that I can be. And moreover, the pain, pain I already mentioned, as well as early ablation. So as she underwent multiple surgeries, and there is a chance of DVTs, because the deep vein thrombosis, as a persons, those who are underwent the multiple surgeries, is a very risk factor they are getting because of the immobility and damage and blood loss and all. So we have to educate on that part also. As a being a nurse, we have to assess for the signs, how to assess what kind of symptoms they will be get, like a swelling or any kind of pain, and the calf muscle assessment and all. So these are all we have to educate the patient earlier itself, what kind of signs they will be developed before the DVTs, so that if they knows, they can tell us, and accordingly we can take the precautions as like a stockings or any DVT prophylaxis. So according to that also we can be prevent that kind of the things. And as come to that is a risk of fall as the early ambulation. So as in our hospital, we have a handout for the fall risk assessment and what measures to be followed. That also we used to provide for the patients. So during early ambulation without assistant, or if they want to go to, washroom or anything, so that handouts if we give, and the post-fall education if we give prior itself, that is also can helpful for the preventing of harm because of the early ambulation come imbalance, and it can be lead. And moreover, the pressure injury, as everyone will be followed, there is a common factors because they are at risk, and that we can be suggest. And most important thing, one more, that mental health considerations. We always ask a patient, because we are 24 hours by the patient side, and we have to understand what mental changes and considerations they are having, the depression, because it's very hard to digest. But I can appreciate the Janet is very strong person to cope up this situation and leading her life and surviving. Now she's presenting her here as a strong person. So that we have to create for the patients, all the patients, those who are undergoing multiple surgeries, the psychological support is always important. We have to gain their confidence. So to undergo this kind of situations, how to cope up, these are all we have to educate as a part of, as a nursing care. Is always psychological support is a very important thing. And the diet also, the dietitian and the doctors can give us orders, but the one who is convincing the patient to take the feeds correctly, and though they have loss of appetite, and if they're not be interested to take, so we always used to support them, and we should educate them the importance, and we have to engage them what kind of food choices. The sir is telling that she has arranged the food from outside to according to her choice. These kind of activities will be done by nurses at the bedside to consider their choices, and they can be involved with the patients for their care, and we can prevent the harm for getting of any other complications. So, and I would like to suggest some new ideas which I thought and still we have not yet implemented, but I just wanted to take the virtual simulations to create a simulate environment where the patients can virtually experience what exactly happens, these kind of surgeries happens, that thing. And if we suggest like if the management supports the AA assisted decision making tools, so this is also can be helpful for the patients, those who are can directly can get the information from AI tools to take a decision in that situations. Then moreover, and the interactive patient portals, the most of the hospitals nowadays, they are focusing on the interaction, the patient portals. So that is also can be helpful to ask a question to get the answers from the expertised people from the hospital to take a spontaneous decision when they are unable to understand the concepts. So I feel this can be a innovative ideas which can be futurely applied in our profession, and we can be put into a practice so that the patient can be more involved and they can take a decision in taking of care.
Thank you. Thank you so much, Sunita, for bringing so many thoughts and a lot of things with regards to how a nurse can engage patient in their treatment and care. Thank you so much.
Thank you.
My next question goes to Dr. Radhika, who is the Chief of Dietetics Department. So my question was, just like how medical and surgical management are important, diet has an important role in expediting healing and recovery. So in this context, could you please share your view on how we can engage patient in planning their diet, considering their likes and dislikes?
Yeah, good afternoon all, and thanks ANEI for conducting this event. And I congratulate Ms. Janet for her strong willing nature to recover and all. And Dr. Parthisarthi sir for highlighting the importance of nutrition. And so in such cases, usually like initially there'll be very much requirement of dietitian and nutrition for their improvement. Like we go ahead with in these cases because there's a compromised GI tract and all, we go with the total parenteral nutrition, which is of utmost importance for them. And because they'll be losing a lot of muscle and all, because through diet, we cannot get the required protein to them. So initially we need to depend on the total parenteral nutrition for the patient. And after which slowly we'll be progressing towards the liquids, taking their likes, dislikes, and their cultural and traditional beliefs into consideration. And their existing needs also will be taken, and also the future needs of the patient will be taken into consideration whenever we are planning a diet. So initially, where to start off also, we may start with the liquid diet also. And something like a soluble fiber is what we look at, because we don't want to tax the GI system with a lot of fiber also. And we don't want any constipation also to occur to the patient, which is not advisable. So we go ahead with the usual plan is a soft soluble fiber is usually given, avoiding all the grainy products and all. We usually avoid them, making it in the form of a just a puree kind of thing, very liquidy puree kind of thing, so that the patient is able to take it, the digestive system as it is in a compromised state. We cannot put a lot of burden on the GI tract. So we need to be very slow in such cases. So home parental nutrition also we can advise them. So that is also of great use. And usually, mostly they have a tendency to take more of caffeine and all. And usually caffeine, alcohol and all we try to avoid, because it has a lot of laxative effect, caffeine. So we try for other alternatives. In order to meet the protein, we give a lot of like lactose intolerance also they may have. So in such cases, we give them a good amount of soya milk and almond milk are the alternatives for lactose intolerance. So grainy stuff like brands and all, we need to avoid them usually. So all other bakery products and maida, refined foods and all, we try to avoid them. So we try to give them something soluble fiber, which is easy to digest. And in such cases, in few patients, we have even tried with infant foods. So infant foods are also of great importance to in such cases where they're easily digestible and they don't tax the stomach much. So infant foods are very, very easily digestible, and they're tolerated well in such cases. The usual complaint, one more issue which we encounter is with water and electrolyte loss of fluids are all lost from the body. So we need to replace them with good amount of electrolytes. Some ORS solution would be a great thing in such cases. So we should see that there is no dehydration in the case, in such cases. So these all things we should consider, and also we can't give them a lot of fat-rich foods, deep fried foods, and all. We cannot give them. So we should always go ahead with the slow transition of fat, maybe in the form of MCT based. Even some preparations in coconut oil also can be prepared, and that's the best alternative for easy absorption of fat in such cases. So these all aspects are very, very important for a patient to initially start off. So once at least 6 weeks or so, once they get adapted to the diet, they're able to tolerate, we can slowly start off with the semi-solid foods and all. And such cases, and very, very important thing what I want to insist on is the fluids, we cannot give them along with the diet. If we give them along with the diet, what will happen? There is no much absorption capacity for the intestine and all, and they'll be eliminated out very easily. So at least half an hour before meal and 2 hours after the meal, if we give the fluids, that will give a lot of advantage to the patient, so that there is no continuous movement of the food in the stomach and there's no disturbance. And most important thing is we need to concentrate that they don't have constipation. That will irritate them like anything. So very, very easy soluble baby foods can be incorporated in such cases. And fruits with skin and all, seeds and all, we need to just avoid them, which are easily soluble, blended in the form of purees, in the form of liquidy based or semi-solid based foods we can try in such cases. So with this, I think, and also dietary recall is very, very important. The follow-up is very, very important. So once we give the diet and just leave them like that, that won't fetch them or us anything. So if it is always better, we follow up with them and understand their condition and make necessary modifications wherever possible. And that would benefit the patient much. So I think with this, it would be helpful for the patient. All these measures will be taken, and this will be helpful to the patient.
Thank you so much, Dr. Radhika. Definitely, I understand your role would be in a very difficult place, because you have some limitations. You have to think about your patient. There are a lot of challenges, and you have to make a customized plan. And you also mentioned that we have to, we can consider baby foods, which is really great and great insight. Thank you so very much.
Yeah.
Now we will move on to the next panel member. We have Kavita ma'am. So, ma'am, my question to you is, as an head operations, as an administrator, and as we are talking about patient engagement in care and preventing harm, could you please share your view on maintaining transparency, valuing the patient's rights, and involving them in decision making?
Thank you, Harita. So I'll start with patient care. So patient care is at the heart of everything what we do. It goes with all the departments. It goes beyond just treating a medical condition. It's about understanding the needs, concerns, and emotions of each and every patient, and delivering care that is compassionate, personalized, and truly holistic. Today, I'm really very happy to talk about how we can elevate patient care by putting the patient at the center of all our and their decision, ensuring their experiences isn't positive and supportive as possible. So I'll start with maintaining, why the patient transparency is important. So basically, transparency is the fundamental to building trust and ensuring that patients feel secure in the hospital. This includes understanding the benefits, risk, and alternatives of various treatments options, which helps patients to make choices aligned with their personal values and their preferences. Knowing the details of their health status and treatment options can help patients feel more secure and obviously less anxious, because normally, they are very much worried about all these points. Coming on to the patient rights are really utmost paramount. Valuing patient rights contributes a sense of empowerment and satisfaction to the patients. Upholding patient rights fosters trust between patients and the hospital staff. When patient feels that their rights are respected and valued, they are more likely to engage openly with the hospital staff they speak more openly, they share important information and adhere to the treatment plans. Then coming on to why patients are important in decision making. Yes, this is very important point. Effective healthcare is a partnership between patient and the hospital team. When patients are involved in decisions about their care, about their treatment, they are more likely to feel empowered and engaged in their own health journey. This sense of ownership can lead to a better adherence to the treatment plans and more proactive management of their health. Patient satisfaction tends to be higher when individual feels heard and respected in their care. Being the part of the decision-making processes helps patient feels more valued and respected, contributing to more positive and overall experience. So if I summarize all the above 3 points which I've just mentioned, that is maintaining transparency with the patient, valuing patient rights and responsibility, involving them in the decision making are really very essential for all the hospitals for providing high quality, ethical and patient-centered care. It supports developing trust, respect, and ultimately leading to the better outcomes and a more positive healthcare experiences for the patient.
Thank you, ma'am. Thank you so much for bringing so much into this question that has been asked to you. Thanks a lot for sharing your views on this. Thank you once again.
Thank you.
Now, my next question goes to our another panel member, Mr. Anji Naik, who is an ostomy care specialist. So, Anji, my question to you is, being an ostomy care specialist and having managing a lot of patients with ostomy, so what do you think, how you can involve patient in this aspect?
Yeah, thank you, ma'am. Good afternoon, one and all. So, as a ostomy care specialist, we used to take care of a lot of patients. With the patient is ileostomy, colostomy, and urostomy. So, in specially, so we used to educate the patient. So, once a patient is come to me, so first of all, we have to educate a patient. So, and we have to guide the patient how they need to change the bag, how they need to manage the bag, and we educate every patient, and at the same time we counsel the patient. So because the once a patient is with a stoma, it's not a easy matter. So because a person who can able to manage and who can able to carry their party within the bag, it is very so hard psychologically for every patient. So in those cases, what we suggest, so for every patient, first we will give the counseling and education. So suppose I'll take one example, a patient with a protruded stoma. It means above the skin level. So if a patient, case number 2, patient with a retracted stoma, the skin level of the stoma. So in these cases, once we will give the correct right product to the right patient, they won't get any issues. So mainly in ostomy, we face the issues of leakage. So for every time we need to suggest a patient, so we need to guide a patient and we need to advise the right product to the patient. So at that time, so we will almost all we will reduce the all risk factors of the patient. So second thing, so when the patient is moving out, so how they need to take care of their pouches and how they need to manage the pouches and how they need to empty the pouches. Mostly we will counsel the patient, we will guide the patient. Especially I'll take in Mumbai Janet cases. So because there is a high output ileostomy and fistula also. So if we can take any chances, if we are not using the right product, so in that situation, if the leakage will happen, it will touches the suture line. The surgeon like Dr. Padasarthi sir has, his efforts will go loss. So because once the suture line will contaminate due to that output, so again the patient will go deterioration. So in this situation, so we will guide it every time. So we need to advise the right product to the patient, and we will give the right solution to the patient. So in apart from this, so for as a patient side, we will guide a patient how they need to take care of their pouches and how oftenly they need to empty their pouches and how they need to apply their ostomy appliances. We will guide each and every part. So and along with this, they mostly of will ostomy patients will ask what my bathing, what about my clothings and all. So we will suggest how those and the stoma size. So we will guide a patient which is very best to where we can give good quality of life they can lead with the ostomy. So in these situations, mostly along with this, the patients will feel the gases. So ballooning, mostly the second issue will face the ostomy patients is ballooning. So for that ballooning, every time we will guide the patients to the according to the dietitians, as like Dr. Radhika madam has said. So like that, so we will give semi-solids, and mobilization part is most important for the those who are with the asthma. So in these cases, so we will guide every patient and how they need to take care of their stoma and how they need to use and how they need to how oftenly they need to clean their ostomy pouches. If they have any doubts, so we have videos and some collaterals we will share with that patient. So it was a very efforts we put it on the in this case. So because we reduced the we that infections, it's a very but I especially thanks to Partha sir, so he suggested 2 3 uh, things to me how we need to take care of a patient. So it's a really tremendous journey with sir. And Mumba Janet also, she is one she have very good patience in this. So she have she will
Jyoti, you are muted.
Thank you, Mr. Anji, so much for giving us insight, into this ostomy care in an elaborative way in a short time. And yes, engaging patient in this matter, definitely we need their cooperation. Otherwise, the task won't be easy. Thank you. Now, my next question goes to the another panel member, Dr. Santosh Reddy, the clinical pharmacy manager from AIG Hospitals. As we understand that medications are very important in any line of treatment, the clinical pharmacy has a vital role in ensuring that the right drugs are being administered at the right time and patients are being monitored. So could you please give us insight on how we can engage patients in management of medications?
Good afternoon, one and all. So thank you, ANEI, for giving this opportunity. So as a clinical pharmacist, we have seen that engaging patients in their medication management is very essential for ensuring the safety and their improving outcomes. So as you know, medication errors are a major concern in healthcare. They can occur at every stage, from prescribing till administration. According to WHO, a medication error is defined as any preventable error which may cause or lead to inappropriate use, or it may lead to patient harm while the medication is under control of either healthcare professions or a patient or a consumer. So this definition is highlighting that patients themselves have an active role in preventing those medication errors. So one is sharing decision making. It's a key element of patient-centered care. When patients are involved in their decisions about the treatment, they are most likely to understand and follow their medication regimens correctly. This involvement also means that their preference and concerns are taken into account, which can prevent issues down the line. For example, Dr. Padsardis has shared the excellent example during the treatment of patient Janet. They involve Janet in the decision-making process when coming to managing their pain instead of relying on heavily on opioids. Which can occur the unnecessary side effect. They discussed the option of a nerve block. So Janet input was very crucial in this decision, and by choosing her nerve block, they're able to effectively manage the pain and avoiding the side effects of the opioids. So this is a great example involving a patient in decision making. So, and then the one more crucial aspect of the patient medication engagement is education. So we need to educate the patients on their medications. What is the purpose and indication of that medication? What is the current usage and how to take them? How frequently used to take them? They should also be aware of the potential side effects, what to do if they experience them. When patients understand their treatments and they are more likely their medications used correctly, which reduce the risk of medication errors in the hospitals or and after discharge. And we have to encourage the patients to communicate openly after the counseling part. They should make patients feel comfortable to ask the question about their medications, whether they are confused of any new prescription medications or any change in their medication regimens. For example, in our India, the patient notice their medications looks generally by the strip colors. So sometimes they will notify that the medications are unusual and they will come and contact the clinical pharmacist about their error. This simple act of communication can catch the medication errors before they cause harm. And one more important aspect is medication reconciliation. This is the one more safety aspect to prevent the medication errors. This involves the comparing of medication errors with the new ones prescribed in the hospital. However, for this reconciliation, patient has to provide the effective medication history at the time of admission. When the patients are engaged and provided the complete information, this helps the doctors to ensure there is no drug duplications and side effects. So in our hospital, we do have clinical pharmacists where they will carry out the appropriateness review after each prescription. So they will come and check whether the drug is appropriate to the condition or not, appropriate dose, appropriate route, appropriate frequency, whether the prescribed drug is having any drug interactions with the previous drugs or not, whether there is a drug having any contraindications or not, whether it is variation from the hospital criteria or prescription, especially for narcotics and opioids, and is there any other drug food interactions with them. So all these criteria will be done by a clinical pharmacist before going forward, before indenting that medication, so that we can prevent these prescription errors landing in administration errors. So the most crucial step in the medication management. And our engagement of patient does not stop at the medication prescription. Even the patient needs to be actively involved in monitoring, like how they feel after taking this medication. They should be informed about the signs and symptoms of these side effects or adverse drug reaction, so that the doctor or the clinical pharmacist can recognize them immediately and report them promptly. For example, if a patient starts experiencing any side effects, reporting them early to the doctor can adjust the treatment effectively. Sometimes the doctor may reduce the dose or they may add other medication to the treatment to improve the patient safety. So this is the one of the safety aspects in the medication management. In conclusion, at our hospital, we recognize the patient engagement in ensuring medication safety is most important. To support this, we have a dedicated team of 50 clinical pharmacists who work as a bridge between the doctors, patient, and nurses. And we involve deeply in every step of medication management, from education of patients to collaborating with the healthcare professionals to prevent these medication errors. By serving as the link, our clinical pharmacist helps to ensure that the patient receive the safe and most effective treatment possible, reinforcing our commitment to medication safety. So with this, I'm concluding my session.
Thank you so much, Dr. Santosh Reddy, for your inputs. You have specified a lot of crucial points which needs to be taken care while medications are being administered. Thank you so much.
Thank you.
I would, as we have completed discussion with all our panel members, however, I would like to come back to our focused person of today's session, Ms. Janet. According to my question to you, Janet, before we close, according to as per your experience that you have shared, having undergone multiple surgeries as a patient and as a nurse, what suggestion would you like to give it to the participants? Unmute. Kindly unmute yourself. Janet, unmute. Yeah.
Sorry for that. My battery just went off. Am I audible?
Yes, you are audible.
Thank you so much. Would you ask your question again?
Yeah. As per the experience that you have shared with us, having undergone multiple surgeries as a patient and a nurse, what suggestion would you like to give to our participants?
Thank you so much. As I mentioned earlier, to say I was nursing two things. I was nursing my laparotomies, I was nursing my cesarean section, and I was nursing my stomas. So I was going through so much pain. The first advice that I would give to the participants are, you can only manage a patient that wants to be managed. The first point that I would love to give is create a good rapport with a patient. The easiest way to manage a patient is having a relationship with them. Because if a patient cannot trust you, they cannot be managed. So the first point is show the patient support. It costs nothing wrong to have a good attitude to a patient. When we have a good attitude to a patient, they are going to trust us and they are going to be more open and comfortable with us. But if we do not bring them close, make them open up, the patients are going to be enclosed and they are not going to trust us. So let's have a good relationship with our patients. We have patients that are coming from all walks of life. They're coming from all walks of life, different beliefs, different lifestyles. So let's try to accommodate every kind of patient that comes our way, and our work will be made easier. I talked of pain. It is not an easy thing to nurse a lot of things at the same time. Pain is what the patient says it is, and it occurs when the patient says it has. So I would suggest to the participants to say, let's try to assess our patients so that they do not also abuse the drugs. Because at some point, I was almost going into addiction because the pain was too much. And there are times when I was discharged, I remember going to buy the drug without the prescription. Especially when I was here in my home country, being a nurse, it was a situation whereby people could not understand me. My fellow medical personnel thought I was exaggerating. But the pain, as I mentioned, is what I'm saying it is. And us as medical personnel, to help our patients, let's do proper assessment. Is this patient really in pain, or are they exaggerating? Or are they going in addiction? Let's also, as nurses, we shouldn't also depend on the assessment of junior nurses, student nurses that are practicing, or newly recruited nurses. Before we gain their trust, let's train them and ensure to say patients are comfortable with them. Because there are times when you would send the student nurses or junior nurses to assess this patient that is in pain. And it is not within us as nurses to prescribe. We are the people that are with this patient 24/7. So when we do the assessment, let's quickly inform the prescriber. Because if we are going to depend on the assessment of a junior nurse or student, at times there were situations, I experienced situations whereby people thought I was exaggerating. And the nurse would tell me, I'm coming, and they go for good. It makes the patient enter into depression and lose trust and confidence in the people that are caring for them. The other point that I'll be bringing to this house is IEC. Let the patient know their condition. Tell them what they are going through. Do not hide anything. Tell them the prognosis of that condition. Like that, it will be easier for that patient to understand their condition and avoid errors. So let patients be well informed about their condition. Let them know what they are going through. In doing so, patients are going to understand their condition and know the do's and the don'ts. Communication is the vital key in nurse-doctor-patient relationship. It is a vital key. If patients do not know what they are going through, they are not going to understand their condition, and they're not going to know what they're supposed to take and what they're not supposed to take. Remember, I mentioned I had an ostomy. There are certain food that it could accommodate and certain food that would irritate me and make it so active. So if I'm not well informed, I'm just going to eat anyhow, and I'm not going to know what is causing the ostomy to be so active. I'll also bring to the attention of this house to say, let the people that are taking care of our patients, in my country, we call them bedsiders. They are also the people that are with these patients 24/7. In times when I could not care for myself, my bedsider, if the nurse is not there, was the one doing the duties. So it makes work easier if even the bedsiders themselves, they are well informed about the patient's condition. And in case of an emergency, being the people that are close to this patient, they are going to act before the medical personnel appear. Let patients be involved in their decision making. Let them be involved in their treatment. I like the way Dr. Patasati and Angie involved me in my own care. Whilst I was nursing my laparotomies, I was also involved in that time. You know, when you're broken down, there is nothing like you are a medical personnel, you are a nurse. On that bed of pain, you literally become a layman. So I love the way he involved me in my care of the ostomy. I had to manage my ostomy. I knew when I needed to change it to avoid pain and to avoid that odor that was coming out from the site. There are times when I could go out in town. I like the way Pata involved me in my decision making because he consulted me. When we want to do this, what do you think? Are you going to be comfortable with this? Whilst informing me, educating me, and engaging me. Let also, a change of environment is also one important thing that will help somebody that is broken down to heal quickly. I was still admitted, but I was allowed at least to go out. That really helped me and quickened my healing process as I was waiting for the reversal of the ostomy. I was allowed to go out to shop, keeping my mind busy, refining myself, and regaining my strength. Coming to the diet, let patient eat what they want to eat. Find out from the patient, what would you love to eat? I was coming from a different nation, worked in a foreign nation, of which I had my own staple food. And the doctor was able to accommodate me in allowing me and actually giving me ideas to cook for myself what I wanted to cook, what I wanted to eat. And the moment he told me to eat what I wanted to eat, I managed to gain weight within the short period of time, and I was prepared to go back to theater. In my conclusion, I want to say let's have a good relationship with our patients. They are going to trust us and they are going to be comfortable with us. Let's also take pain management seriously and ensure our patients don't go in drug addiction. Let us support our patients psychologically, because a patient that is broken down delays her healing or his healing process. Even if the situation does not seem like it will work out, support them emotionally by giving them a positive mind. Allow them to serve their God that they serve, coming from different religion. It will also help them. Thank you so much, and a shout out to my Indian family. Thank you. I submit.
Thank you. Thank you. Thank you so much, Janet, for your sharing your journey and then for giving us great suggestions. All your points are well taken. The team has noted your points. Thank you so much. So no doubt, patient engagement is going to be the blockbuster therapy in days ahead. So thank you all for sharing your experiences and giving wisdom to, by our esteemed panel members. Thanks a lot. Now, yes, ma'am. This session is open for any questions from our participants. I would like to ask Tanga ma'am, Unmuna ma'am.
Yeah, it was a wonderful session, wonderful speakers, and lot of learning from the patients particularly. And all the speakers are talking like, we are thinking like we cannot stop hearing and we want to hear more and more. And you are conducting very well. But now my humble request to Madam Thangam Gomez to give the concluding remark and to take over the session and to end it.
Thank
Thank
you,
you,
Unmuna.
ma'am.
Thank you, Unmuna. I am very emotional, Janet, because I heard that word broken down so many times. Sometimes we don't tend to understand that. So I think, first of all, congratulations to the Telangana team for hosting something so close to the heart. And Janet, for having the courage to come here and share your journey. All are basics, if you look at it, all the things that you are saying is basics. Dr. Partha did what he could. And he's a champion in bringing all of them together and giving you the best. Just give me 2 minutes.
Good afternoon. I had one small question. Is that okay to ask?
Yes, Dr. Jyoti.
This is regarding pain management. I don't know if Dr. Partha is still around. So I just wanted to check, like, till what scale do they surgeons manage the pain, and beyond what scale do they ask the anesthetist or the pain management team to step in? Or is it that the nurses directly take a call? If the pain scale is, for example, say till 4, then the primary team manages, and if it is beyond 5 and beyond, then direct call goes directly from nurses to the pain management team, anesthetist or pain management team.
Dr. Jyoti, Dr. Partha is, I think he left the
Yeah,
group.
I thought so.
I will try to answer that question because I have, this is very close to my heart. Pain management, nutrition, early mobilization, and communication. I mean, these are like pillars for nurses. So when it comes to pain management, there is one thing that probably we don't do in most of our assessment is asking the patient, after educating them on the pain scale, what is the number that you are comfortable tolerating? So it's like a headache. I can tolerate up to 7, maybe. Somebody else may not tolerate even beyond 4. So I refer to what Janet told. Pain is what the patient thinks.
Subjective.
And then in every hospital, there can be an algorithm which says you can go back to the WHO pain ladder and then refer to it and create an algorithm where every organization will have standard instructions, because patients who are expected to have pain will have some decisions already made. At this level, you can do this, and when it needs to be escalated, that matrix or the algorithm should be available to the team, whoever is looking after the patient. So that is what any clinician would like to have, because they don't like to be informed for every little pain, because pain is expected. But what I want to just to summarize, to say thanks, Dr. Jyoti, for that question, because that's a very, very relevant part of taking care of patient, and Janet brought that as her first point. And I just want to emphasize, because this is getting recorded, hopefully many more nurses and nursing students will definitely go and view this recording. And I would like them to, learn the basics that Janet was just asking. Communicate. Know me as a patient. Tell me what is happening to me. Educate me, inform me, involve me. Exactly the voices of every single patient. Janet, you are such a warrior, such a survivor. I am so honored to have met you in this platform, because I have seen patients who had multiple laparotomies and how bad they fared. In my journey as a critical care nurse, I have seen that, having 10 operations, and lucky to have you sitting here and, talking to all of us is such a touching journey, and that's why I just could not go away from here. I was just, just listening to all your points. They're all very, very powerful points. And Dr. Partha mentioned 2 things that I keep on advocating to nurses in all the sessions that I do is communication always had been my, I always say communication is the fulcrum of healthcare. If that fails, everything else fails. Dr. Partha mentioned about nutrition, early mobilization. There is enough literature evidence coming out that patients on ventilator, if they can move out, they should be mobilized. And I think Janet's case is a classical example of where all the multidisciplinary team worked together to ensure that, she is back to herself, whether it is the physiotherapist, the pharmacist, the ostomy specialist, the dietitian, the operation, the administrators, the doctor, little things, the food being customized for her. And she just mentioned, the moment I could take the food that I wanted to take, I gained weight. I could go back to surgery. I mean, these are things sometimes in the daily, business of looking after so many patients, sometimes we tend to overlook personalizing something for the patient. Because, many times nurses may even say that, sorry, we can't help, this is hospital rule. But if we can't help, the patient body is not going to accept and, get healed. So this is a classical example of being with the patient as an individual and supporting them to heal themselves. And that's the biggest message I could hear from Janet, is that involve us. It is their body that we are handling. So it is not that whatever that we learned, we just kind of prescribe and just do it and say, now everything will happen. That all needs to happen. That's important. And Dr. Partha is not here. Harita, please, on behalf of ANEI, please go and, give him a very, very big thank you for being here with his patient, and gratitude to each one of the panelists here. Fantastic discussion. And I'm very happy that ANEI is able to do all these things. And they are all being recorded and, kept for future generations to, view and learn. I really hope all the leaders, if any academician sitting here, you should go to these various recordings. We have many. Just use them as CNEs in your auditorium. Get the nurses to come to the auditorium, watch the recording, and let them have a discussion. What did they learn? And I can tell you that we can do a great thing, but just doing that, because you don't have to make the presentations. You don't have to talk. It is already there in the recording. Why not use it? We need to exploit the opportunity that is being created once, to let it give results multiple times over. So thank you. And every chapter is coming here and doing a fantastic job. We still have few more months left for 2024. We are going to focus on that. And next year, Empower Hour, patient is not going to be very far in every Empower Hour. Everything leads to patient safety. All the roads of healthcare or any hospitals will have to lead to patient safety. So thank you so much. And I really apologize for being a little emotional. I was trying to put myself in Janet's shoes and I could not take it anymore. That's why, so that is something I learned when I was trying to train empathy. So if I become a nurse like that, I will not be able to do something for Janet. So I always used to say, okay, understand what the person is feeling. Now look at yourself and say, what is it that I will do if I am Janet's, mother or, sister or someone? What will I do for her? Then I will not ask the question, when Janet says that she's in pain, I will ask her, how can I help you? And as a clinical nurse, I will refer to what can I do for her, right? So I can go on and on. Sorry for talking a little extra. But thanks to the entire team, I'm not taking names. Each one of you had fantastic, inputs. And yes, Sunita brought in the technology piece. That is also something nurses must get involved, because that can, offset a lot of things that we are manually doing. It will give us more time to be with the patient. So Unmana, thank you so much. And Harita and team, thank you. And Jyoti did a wonderful job of moderating the entire thing. Thanks a lot, and look forward to the next Empower Hour.
Yes, thank you,
Thank
ma'am.
you, Janet. Thank you so much.
Thank you, ma'am.
Yes, she will be inspiration for everyone. Janet will be real inspiration for everyone, not only the lesson for healthcare, for nursing, but the lesson for life. Thank you so much. Thank you, everyone, from my side.
Thank you. Bye-bye.
Thank you.